Here is the world's most normal looking appendix for the reasons we will soon describe. If a surgeon took out a lot of these appendixes or appendices and they looked like this, he would eventually get into trouble because he would be taking out normal appendices. Let's look at the salient features of a normal appendix in its perspective as being a classical, typical example of just about any part of the GI tract. The glandular elements that you see here, not only on the surface, but a little bit in, are mucus secreting cells, and they are simple columnar epithelium. Notice that there's a lot of lymphoid connective tissue between the surface and deeper epithelium. And in some areas, this lymphoid tissue forms actual follicles or secondary follicles, where you have lighter areas on the inside, the germinal centers, and then darker areas on the other side. Notice that this lymphoid area is actually the majority of the thickness of the appendix itself. And this is all mucosal and submucosal lymphoid tissue. Notice that the lymphoid tissue can in areas come to sort of an abrupt ending, in which you could then see perhaps a few small muscle fibers, but the tissue then deep to that is very loose. It's basically loose connective tissue, classical fat like you see here, a lot of veins like you see here, arteries like you see here. This is the classical submucosa. You then have layers of cells which are arranged both circularly, acting like a sphincter with relationship to the longitudinal axis of the organ, and then on the outside of that you have fibers running in the other direction or longitudinal. Circular fibers, nuclei, will look spindly. Longitudinal fibers and nuclei will look quite round because they are cut simply at a different geometric plane. Just beyond that is a small layer of loose connective tissue again, and the appendix is clearly intraperitoneal, so you are absolutely allowed to see mesothelial cells like here, and here, and here, and here, and here, where you can see the actual nuclei. These are true mesothelial cells covering the surface peritoneum. You would not call this adventitia. You would call this peritoneum or serosa or visceral peritoneum. You can call this a blood vessel because it is. You can call this muscle fibers cut transversely to their axis. You cut these muscle fibers cut longitudinal with respect to their axis. You could call all of this loose connective tissue submucosa because it is. You can call all of this lymphoid tissue primarily mucosal, but sometimes extending well into the submucosa. And you then call, going backwards now, the surface epithelium and the small invaginating glands, or pits if you would like to call them that, the mucosa of the appendix, and the intervening cells in the mucosa, chiefly lymphocytes and some connective tissue cells, would be lamina propria. I want to say one more thing. Notice that both the circular as well as longitudinal muscle fibers are nice and clean. What I mean by that is there is no infiltration of inflammatory cells, especially neutrophils, into these muscular layers. And if there were, we could then diagnose acute appendicitis. But I guarantee you, if we drove around this entire appendix, we would never see any significant infiltrate of inflammatory cells. We do, however, see some dilated blood vessels in the serosa, which is quite common, even secondary to surgical manipulation. But there is no infiltration of inflammatory cells into the muscular layers. And I thank you very much.